So our Physician of the Year award is a new award, and as we worked through the qualifications, it is an active or associate member of the medical staff. And then there's a nomination form where physicians can fill out to nominate one of their peers for having an impact in the community or an impact on a patient or themselves as a peer-to-peer, providing clinical knowledge at Good Samaritan or improving the overall medical community in some way.
So there are several considerations when we came up with the Physician of the Year award, which we have named the SAMI. The first is really exceeding what the expectations of you would be as a provider in our community as far as your practice is concerned. One of the other qualifications that we looked at specifically was leadership within our organization, Good Samaritan Physician Network, Good Samaritan Hospital, or within the medical staff.
But really, the nomination comes from our colleagues, and so your work, the reason you'd be nominated is how your colleagues view your work through their eyes.
Dr. Stewart deserves this award because he has done an exceptional job over the course of the past 9 months, specifically addressing the issues associated with the COVID-19 outbreak and pandemic.
Thank you very much for this great award. It really is a humbling experience. I want to thank my peers on the medical staff for this great honor they've given to me. Thank you to the hospital administration, and a really big thanks to the entire Good Samaritan family for the wonderful work they do here and the wonderful friendship and camaraderie and high quality health care we all provide. I've so enjoyed the 44 years that I've worked at Good Samaritan Hospital that I really understand, particularly as a general internist, what the word teamwork is. And an award like this is something that, in my opinion, should be chopped up into little pieces and distributed to everyone, kind of like a basketball basket at the sectionals.
Dr. Stewart does an excellent job of pulling information in from others, assessing the situation, and has been a pretty steady individual through all of this.
You know, Dr. Stewart, he is a great person. You know, he's not just a great physician, he's a great man, a great father, a great husband. I was thinking about him earlier today, and he's the kind of guy I think you would like to be partners with. You know that he is going to be reliable, he is going to take care of the patients. He's just somebody that you know you can trust really with anything.
So I've known Dr. Stewart for about 20 years, and he's been an exceptional example of evidence-based practicing clinical physician to all of us in the medical community. He's very wise, he does not make rash decisions, and he's excellent in terms of direct patient care. He's always been very caring, he's always been exceptional in terms of communication with patients and family.
A really good doctor, very caring, very loyal to his patients, you know. Just an all-around knowledgeable guy and a hard worker.
When I first came to town, I was recruited by Dr. Dason, and I came down here to look, and it seemed like a very nice community, a very good hospital and so forth. But when I looked at Dr. Dason's office and tried to read his charts, I couldn't begin to read his handwriting or decipher his charts, so I told him, thank you very much, but I think I'll stay in Indianapolis. And then I got a call from Dr. Combs, and the advice that I got from Indianapolis was that you've been trained in medical care but not office management, so you need to go in with Dr. Combs. And I joined Dr. Combs and Dr. Hippensteel. We were later joined by Dr. Felt. I've also enjoyed in my practice a lot of work with long-term care. I have done an outpatient clinic at Vincennes University, and I have really enjoyed the experience that I've had with inpatient rehab that I had at Good Samaritan Hospital, which was like a second career. As I look at the things that have been done at the hospital, I realize it's all about teamwork, and that's really what we do here.
We work collaboratively with them at our testing sites. We set up grant capabilities to expand testing through the health departments, and we're able to do that from resources that they were able to pull together with our resources. So it's just been a phenomenal working relationship. I've had compliments from civic leaders to public representatives at the White House level that have said, when they're rounding through the state, have said that the communication in Knox County has been some of the best they've seen, and that really is Dr. Stewart in that leadership role, Good Samaritan, and people looking to those two resources to guide them.
And he didn't take a scare tactic, like you're going to get this virus and die. He just said, you got to protect yourself. You got to protect your parents, your grandparents, your children.
There's a lot of things that he has done really throughout his career that have been above and beyond the call, but I think what makes it exceptional in this case is Dr. Stewart didn't really sign on for any of this. When we all look back a year or so ago as what we were doing and what our lives were like, Dr. Stewart took on our health department and really dedicated himself to looking at the functioning of the health department and making improvements in the health department, having absolutely no idea what was coming in the months ahead.
It's nice that he is the first award winner. He's set the bar pretty high, but he's someone who definitely deserved the award and will be someone we will remember as we select more award winners through the years. He has worked hard, and his desire for continued education and seeing the hospital grow is evident, and he definitely leaves a great legacy.
As we have this time of crisis pulling us together, my hat's off and shout out to the frontline workers. I look at the physicians and the nurses working the intensive care unit, the 60-hour weeks they're putting in, caring for sick patients, putting their own lives in danger with COVID. And I will say to you, thank you so much for all that you do. I really wish I was still at a point in my career where I could be there with you, but we'll do all that I can to support in the public health role that I'm in right now. And again, thank you all very much for this great award which you have given me. Appreciate it.